Hi, Dr. Pandita. It's great to have you join us today to discuss how hospitals and health systems can develop effective AI operational governance playbooks. I'm John McFarland, head of the U.S. healthcare practice at Bernstein, and I'm delighted to have joining with me today Dr. Deepti Pandita, the Chief Medical Informatics Officer at the University of California Irvine Health. With her impressive background and passion for innovation, technology, and the improvement of care delivery, Dr. Pandita is widely sought out to often share perspectives on the ever-changing and evolving care delivery environment and the tools and solutions supporting such. Thanks so much again for joining us, Dr. Pandita.
Thank you, John. This is an awesome opportunity. Thank you for having me on.
Well, certainly, certainly. Well, let's dive in. In 2023, it seems like it was a coming out party of sorts for generative AI. And with so much of the hype around generative AI behind us from 2023, it really seems like the next couple of years are really going to be poised around focus and digging into and fleshing into an enormous amount of use cases for healthcare organizations. Um, as many organizations kind of stand at the foot of the mountain, per se, kind of staring up, what do you think they should really consider with regard to taking a quick step back, maybe having a plan, and the overall process for that due diligence?
Yeah, that's a great question. So again, like you mentioned, 23 was the year of AI, and we had like a gold rush of AI. There's every piece of technology that we employ in healthcare now has an AI component. So I think it's critical that healthcare organizations, approach this process of potential use of AI technology with careful consideration. First, make sure that you're not doing AI for the sake of AI, but you have a clearly defined objective and goal as to what is the problem you're trying to solve. So again, I am a big fan of user-centered design principles. And again, if there is a problem that you are trying to solve currently, and you have done the workflow analysis, and there is a potential solution from a technology lens with utilization of AI, then that's a perfect use case for AI. However, if you are deploying AI for the sake of, oh, this is the new, shiny object out there, and we should be using it, otherwise we'll be left behind, and you already have a solution that's working perfectly fine, that is not a good use case of AI. So again, I think organizations need to take a very clearly objective defined approach in AI implementation. And then again, healthcare organizations need to make sure that they are ready for this, because not every organization has the tools and resources and training and availability of IT systems that can scale up AI. So being aware of your own capabilities is also very important in this process.
Oh, certainly. I mean, that's very helpful, Dr. Pandita. And, you and your team have long been involved in really exploring and also, when it makes sense, implementing a number of different evolving tools and solutions to improve care delivery and outcomes. You really take the approach of taking the end in mind first, then working backwards. So can you share a little bit about how um, UC Irvine Health really looks at the problems that need to be solved first, then really goes out and takes the next step of looking for the specific technologies and solutions to meet those problems, to solve those problems.
Right. So I would say let's start with do I have a problem? So that's the question I always ask myself, and I encourage my teams to ask the same question. Is there a problem? If there is a problem, do we know a root cause? If we know root cause, then do we know that, or if there are multiple root causes, which one bubbles to the top? So it's your very typical lean problem solving approach. And then once you land on a root cause, then you say, okay, can this be solutioned through technology? And if there is a solution, whether it be EMR driven or a third party vendor, whatever, then you decide, okay, can AI augment the solution? So perfect example would be all organizations have EMRs, and a big problem we have currently is in-basket management, because providers are, really under a deluge of messages from patients, and this really escalated post-COVID and during COVID, where the volume of messages is really unmanageable. So the problem you're trying to solve is, how do you manage in the physician's in-basket in terms of the volume of messages? And that's a problem. We know root causes that patients want to reach out to their physicians for their questions. And one of the solutions would be, could we use an AI solution which like a bot that answers a lot of these questions with a human in the loop? So we took that approach and we said, do we have an existing solution? And yes, we have an EMR that is pretty robust and can manage in-basket messaging. And the EMR offers an AI chat GPT solution to answer some of these messages. And so, we took that solution, and yes, lo and behold, we did show that there is some time savings in terms of the time spent in the in-basket for physicians. It's not substantial, but it is there. And then now what we are trying to do is have that iterate and adapt approach, where we are seeing which types of messages can be auto-answered, which types of messages need further refinement, can we improve the prompts that we are using for the AI solution, and over time, this process will improve.
No, that's great, Dr. Pandita. And, taking that one step further, we know with generative AI, there are some obvious use cases across both the clinical and the administrative elements of the entire healthcare organization. With that said, what are your early perceptions, at least, of how some of these initial use cases are resonating across these areas? And, even further, do you see those trends staying the same going forward in the future, or making a dramatic shift one way or the other?
Yeah, so I think there are some use cases which are, in my mind, what I call no-brainers, which is the use of AI for administrative tasks, because these are high yield and somewhat lower risk. So for example, ambient listening tools for documentation, tools that do note summarization, tools that can auto-generate coding and billing, tools for prior authorization. So these are all, administrative tasks that a clinician does that adds to the cognitive burden, but can be sort of, in my mind, outsourced with AI, still keeping that human in the loop approach, and has generated really good results. So those are the top of mind use cases. The use cases that are still evolving are actually around the decision support and diagnostic area, because these are somewhat higher risk. If AI gets even one CT scan wrong, or one decision support wrong in terms of sepsis prediction or something like that, it impacts patient lives. So these are the ones that you should take a cautionary approach, and they require a lot of testing and evaluation, have a research methodology around them to actually study outcomes, study if there are indeed lives saved, and only then you deploy them. So that is where a little more cautious approach to validation is needed.
Yeah, certainly, certainly. I think it's human nature a lot of times for us to kind of think that everyone is on the same journey when we're in our specific journey. But I think both you and I know, and many others out there, that the journey of due diligence around generative AI is really very varied. You've got a number of organizations such as your own that are really perfecting that journey and due diligence and really digging in. There are other organizations that haven't really pulled back the onion, peeled it back yet. So, with that said, for those healthcare leaders that are really just starting this journey, embarking on it around generative AI and what it means to their organizations and the next steps, et cetera, what advice would you give those healthcare leaders to think about from the learnings that you've had thus far?
Yeah, I think, my biggest, advice would be that don't follow the hype blindly. Everyone's talking about AI and everyone is having sort of a fear of missing out. Um, you know, just get educated first. Ensure that your teams have the right sort of background to guide any AI solution. And then go back to the drawing board and see, are there problems in the organization that you're trying to solve where AI could potentially be a solution? Um, your job is one, to identify problems and propose solutions. But on the other hand, your job is also to educate your health system around where AI can be helpful. So, and you have to sort of navigate both the lanes with caution in terms of making sure that you're not going overboard. You have to set up right governance processes, engage the right stakeholders, make sure that this is not an IT-driven initiative. It has to be an organizational initiative. And then I cannot underscore this enough. Make sure that you're doing this in what I call responsible AI. So in a manner that is ethically responsible, has the regulatory oversight, has the whole evaluation of the tools and technology in terms of bias, and make sure that the AI is actually solving a problem with algorithms that are applicable to your patient population. Because again, remember, AI at the heart of it is, especially for large language models, it's the next predicted word. It is basically taking information from the internet, it's taking algorithms that have been developed off of that information. And if none of that has been studied in your patient population, that AI is never going to work for your people. And then you're going to be regretting why you ever implemented it. So again, being educated and staying abreast of all these factors is very important.
Another great piece of feedback, Dr. Pandita, and thanks so much for joining the conversation. This is, I know your thoughts, your perspectives, and your advice are invaluable. So thank you so much for joining us today.
Thank you. It's been a pleasure.
Certainly. Take care.
All right.